Medical professionals have read it. Have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Rural ER doc, here, 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee, and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex, and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in sperm travel. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital." EMS here. Had a diabetic in his 30-40s who refused to take insulin since 2012, it was 2020 at the time. When I took his blood sugar is only read as HI, meaning it was over 700 for glucometer, to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his fore and play with the fore wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. Saw a chart once where a person came in for a burn to their eye. They told the DR they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. I was using meth for weight loss, have heard a few times actually. There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. Had a buddy who was an EMT, he was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling suicidal. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. Had a patient come in for facial burns because he smoked while wearing his oxygen, twice, in the same week. This happened in med school on my OB/GYN rotation. Patient, who's the baby gonna look like? Me, what do you mean? Patient, well, is it gonna look like the dude who got me pregnant or the guy who's been nutting in me the last few months? Me, utterly speechless, the baby should look like the people who conceived it. This person is now a parent. Asterisk edit, fixed a typo. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note, 3 weeks later her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control and the city had to get involved. Physical therapist had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15 to 20 cups of coffee daily. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection, and she said, Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs. I left that one to the doctor. This was one of the funniest yet cutest one, was a student doing a shift in andrology/reproductive health, doc, asterisk so you're trying to have kids, but not managing to. So do you have any other kid, asterisk patient, asterisk yes, doc I have one. Asterisk doc, asterisk okay, so we need to do this and that asterisk patient, okay, great then, he proceeds to visit him and stuff, after which he goes away. After a couple secs he knocks the door again saying, hello doc, my wife told me that it would be relevant to you that the son I have is adopted, but that's make no difference to me, I always considered my own son. My wife is an anesthesiologist. When training junior doctors, one of the things she has go reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think, fun, and take them even if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and I didn't use any drugs. Then I smelled iron in the air, and then I found out there was blood all over the hallway, handprints and blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. Vet Med here, we get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control. So we often get ones with thyroid, diabetes, heart issues, etc., and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they are still giving the med, nope they stopped it, cause they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. Literally yesterday. Consumed 8 cans of Red Bull in a 2-hour time frame. Presented with palpitations and severe chest pain. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there however has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. I'm in the ER. So many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. Patient seemed relieved and the sister hustled her out of the ER before I could discharge her. A woman called 911 because a cougar attacked her cat. She thought we could help the clearly dead cat. A man called 911 because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy butthole. Took him to the ED because we have to. The doctor asked the patient if he had put the cream on his butthole that he gave him last time. Patient said no. Next time patient called us for his itchy butthole, I offered to put the cream on his butthole for him, he declined. Took him back to the ED. Lady brings her baby into the ER with a rectal temp of 103. Kid's tacky as hell and looks like shit. Refuses all medications. Says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an NSAID. Keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital, and that she recovered medication herself, for epidural, etc. Doesn't budge. Only concerned for herself, told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen. For like 5 whole seconds. Left against medical advice. People like this exist and breed. Woman comes in with no prenatal care to labor and delivery in labor. OBGYN resident taking a history, do you have any allergies? Patient, yes I'm allergic to water. Resident, okay, what kind of reaction happens when you drink water? Patient, oh it makes me pee. Yeah lady that's a feature not a bug. When I was in the hospital as a patient there was this one guy in ER who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s, it is a